If you're over the age of 60, I want to speak to you as a neurologist and as someone who has seen far too many healthy lives turned upside down in the blink of an eye. Not because of heart attacks, infections, or even dementia, but because of something far more subtle, something sitting quietly on your bathroom shelf or kitchen counter, something you've been told for years is good for you. Vitamins. Yes, vitamins. Those little capsules you take to protect your bones, boost your memory, or keep your energy up, can, when taken improperly, quietly lead you toward a devastating event like a stroke, brain bleed, or irreversible nerve damage. And the worst part? Most people have no idea. In my years as a brain specialist, I've treated patients who took their supplements with the best intentions. But their bodies, already more vulnerable with age, processed those pills differently than they did decades ago. The result? Catastrophic and often preventable. Today, I'm going to walk you through 5 commonly used vitamins: vitamin D, E, B6, A, and niacin, B3, and explain how, in excess or when taken incorrectly, they may significantly increase your risk of stroke, bleeding, nerve damage, or even permanent cognitive decline. I'll also share what you should be doing instead. Let's begin, because this information may very well save your life, or the life of someone you love. 1. Vitamin D, the silent hardener of your arteries. You've probably heard that vitamin D is essential for strong bones, immune function, and even mood regulation. That's all true, when taken appropriately. But here's what many older adults don't know. Vitamin D is a fat-soluble vitamin. That means it builds up in your body over time. When taken in high doses, particularly without routine blood testing, it can lead to hypercalcemia, or elevated calcium levels in the blood. Too much calcium in the bloodstream can cause your arteries to become stiff and narrow. This condition, called vascular calcification, significantly increases your risk of hypertension and ischemic stroke. And here's the twist. Most people have no symptoms until it's too late. One of my patients, a 74-year-old Navy veteran, took 10,000 IU of over-the-counter vitamin D every day for bone support. He felt fine, until one morning his wife found him unable to speak and partially paralyzed. Blood work revealed dangerously high calcium and stiffened arteries, classic signs of vitamin D toxicity. What went wrong? He took vitamin D in excess. He took it at night, when calcium levels are more prone to surge, and he didn't monitor his serum. 25 OHD levels with a physician. Medical takeaway: adults over 60 generally only need 600-800 IU of vitamin D per day. More than 2,000 IU may be harmful unless medically indicated and supervised. Always take it in the morning. And if you're also taking calcium or heart medications, speak to your doctor first. 2. Vitamin E, the unexpected risk for brain hemorrhage. Vitamin E is often marketed as an antioxidant and heart helper. It's believed to improve circulation, support memory, and reduce oxidative stress. But here's what many don't realize. Vitamin E acts as a natural anticoagulant. In plain terms, it thins your blood. When combined with aspirin, warfarin, clopidogrel, Plavix, or any other blood-thinning medication, vitamin E can dramatically increase your risk of a hemorrhagic stroke, a type of stroke caused by bleeding in the brain rather than a clot. Case in point, an 81-year-old librarian I treated was on warfarin for a heart valve condition. She added an 800 IU natural vitamin E capsule to her regimen after seeing an ad. Within 3 weeks, she experienced a sudden brain bleed, no trauma, no spike in blood pressure, just too much anticoagulation. Medical takeaway: the recommended daily allowance of vitamin E for older adults is just 15 mg, 22 IU. Most over-the-counter capsules contain 201,000 IU, far exceeding what's needed. If you're on any anticoagulant medication, avoid high-dose vitamin E supplements unless cleared by your physician. 3. Vitamin B6, the brain booster that can backfire. Vitamin B6 is frequently included in nerve health or brain support formulas, often marketed as a way to boost focus, mood, or energy. Ironically, chronic overuse of B6 can cause irreversible nerve damage. Unlike some other B vitamins, B6 doesn't flush out easily. It accumulates in your tissues. When levels get too high, it damages the protective myelin sheath around your nerves. The result? Tingling, numbness, balance issues, tremors, and in severe cases, cognitive dysfunction. A former truck driver, 76 years old, came to my clinic with balance problems and numb hands. His labs were normal, except his B6 levels were off the charts. He'd been taking 200 milligrams per day via a nerve supplement for over a year, 20x the safe upper limit. Medical takeaway. The safe upper limit for vitamin B6 in older adults is 100 milligrams a day, but most only need 2 to 10 milligrams from food and supplementation combined. If you are taking a supplement labeled for nerve support or energy, check for B6 content and discontinue high doses immediately if you're experiencing symptoms. 4. Vitamin A, the fat-soluble threat to your brain. Vitamin A is essential for vision, immune function, and skin health. But like vitamin D, it's fat-soluble and stored in your liver and tissues. Over time, it accumulates and can cause intracranial hypertension, a condition that mimics brain tumors or stroke. One of my patients, a 79-year-old piano teacher, developed daily headaches, blurred vision, and slurred speech. We suspected a stroke, but imaging showed pseudotumor cerebri, a condition of elevated brain pressure caused by vitamin A toxicity. She had been taking 10,000 IU per day for years, thinking it was helping her eyes. Medical takeaway. The recommended intake of vitamin A for older adults is 700 to 900 mcg RAE day, approximately 2,300 to 3,000 IU. Excessive intake, especially from retinol-based supplements, is dangerous. If you're taking a multivitamin, anti-aging formula, or vision supplement, you may already be exceeding safe limits without realizing it. 5. Niacin, vitamin B3, the double-edged sword of heart health. Niacin is often prescribed to lower cholesterol and triglycerides. It's also found in many over-the-counter heart health or cholesterol support supplements. But niacin, especially in doses above 50 milligrams, can cause vascular instability. Here's why. Niacin causes vasodilation, leading to temporary flushing of the face and a drop in blood pressure. But afterward, it can cause a rebound vasoconstriction, tightening of blood vessels. This yo-yo effect can trigger hypertension, arrhythmia, or even a transient ischemic attack, mini-stroke, in vulnerable individuals. An 82-year-old former postman came to me with facial flushing, dizziness, and morning chest discomfort. His niacin supplement, 1,000 milligrams twice a day, 64 times more than he needed. Medical takeaway. The safe daily dose for niacin in seniors is generally less than 50 milligrams a day unless under physician supervision. Flush-free versions may reduce discomfort but still carry cardiovascular risks. So what should you do instead? Let me be clear. I'm not anti-vitamin. I'm pro-awareness. Vitamins in the correct doses can be beneficial. But for seniors, the line between enough and too much is razor thin. And the older your body, the slower your metabolism, the greater your medication list, the higher your risk of adverse effects. That's why I encourage my patients to focus on nutrition from real, whole foods instead of pills. A sample brain-healthy breakfast. 1 boiled egg, protein plus choline. 1/2 avocado, monounsaturated fats. 1 slice of whole grain toast, slow-release carbs. A handful of blueberries, polyphenols plus antioxidants. Water at room temperature for brain hydration. No powders, no megadoses, just the nourishment your brain was built for. Final words. Your health is in your hands. Aging is not the problem. Uninformed habits are. And the most dangerous pills are the ones we take without question, because we believe they're harmless. You don't need to fear your supplements, but you do need to respect them. Read your labels, talk to your doctor, and if something doesn't feel right, fatigue, dizziness, balance problems, tingling, don't assume it's just getting older. It might be your body trying to warn you. If you've taken anything away from this, let it be this. Awareness is the best medicine. At 60, 70, or 80, you still have the power to make choices that protect your brain, your body, and your independence. Let's use that power wisely.